what we've come to recognize over the last 10 years or so increasingly is that for any type of depression or any mood disorder, treatments such as light therapy are a crucial part of managing the condition, but also what we do to look after ourselves, our self-management techniques and skills are a vital part of living well with a mood disorder or a form of depression. And so the next 10 minutes or so, I'm going to be telling you about what you can be doing for yourself in addition to looking at treatments like light therapy. Just briefly, I'm going to talk to you about ways in which you can learn more about winter depression or SAD. I'm going to focus specifically on 3 types of educational learning, and these are all different levels of different ways of measuring your responses to the seasons. And then I'm going to end up at the end of the talk talking about some prevention and intervention strategies that you can use to ward off episodes of depression. This was white earlier on, so I'm sorry. I'm going to talk through the slide because it isn't too clear on this one. It feels a bit like preaching to the converted here, talking to you about the need to educate yourselves about winter depression when you've come out on a beautiful day like this. So I applaud you for being here. But there are a number of other methods for you to learn more about seasonal affective disorder. Ray Lamb already mentioned the very thorough and comprehensive mood disorders website we have at UBC and the SLTBR website. We have a number of regional or local organizations which include the Canadian Mental Health Association and the Mood Disorders Association of British Columbia, and they have some excellent resources on their website and different ways and techniques for managing depression broadly rather than winter depression per se. One thing I'd like to touch base with you about is a particular type of psychological treatment called cognitive behavior therapy. And one of our colleagues in the SLTBR group, Dr. Kelly Rohan from the University of Vermont, has spent the last 5 years or so really researching in detail the use of CBT or cognitive behavior therapy for the treatment of winter depression. She has a book that's about to be published. It can be pre-ordered or viewed on Amazon.com at the moment. And this is, unfortunately, at the moment, this isn't available in a sort of consumer version, but what it is a therapist's guide for tailoring CBT specifically for winter depression. It does come with an accompanying patient guide, and you get the 2 books at the same time. And if you do have a clinician that you work with, or you can look on the UBC website for a resource list for clinicians in our local community who specialize in CBT, you can then take this manual to your clinician and work through the different cognitive behavior therapy techniques for addressing winter depression. There are a number of other excellent books available as well, though. The most well-known book in the field is by Dr. Norman Rosenthal, and there's a second edition of this book, the one on the left-hand side of the screen that's just become available, called The Winter Blues, and that talks in more detail about a lot of the stuff that I'm going to be referring to over the next few minutes. My book of choice for CBT for depression broadly is the book in the center there, Mind Over Mood. And this is really kind of a workbook, and it gives you a number of homework exercises and techniques that you can use to incorporate cognitive techniques into your everyday life. And then regardless of the type of depression that we have or suffer from, I think that communication is often damaged by depression one way or another. And there are 2 chapters that I particularly like in this book by David Burns, the Feeling Good Handbook, which talks specifically about ways in which we can focus on learning to communicate better with other people. I'm going to talk to you now briefly about 3 different types of measurement that I think are important for understanding more about our individual patterns. Now, I'm going to suggest that a useful thing for us to do broadly is to start to look at our overall pattern and history of lows and depressions over our lifetime. So this has been termed life charting, and the idea is with this that really you're trying to get a helicopter view or an overall view of your history of your lifetime. And if you've had many episodes of depression or periods of feeling down over your life, it may be difficult to get this to do this in one sitting. So I would recommend just perhaps starting with the most recent couple of years. But the idea is that what you're trying to do is stand back and look back historically over your life and have a look at your course of illness. If you did experience episodes of depression, when did they occur? Did they occur over the summer? Did they occur over the winter? And then importantly, what was happening in your life around those periods? So for example, if you look at the bottom of the slide here, you can see that this particular life chart, which is asking a person with bipolar disorder, a person who has highs and lows, so it's asking them to look at, first of all, their life events. What things are happening in terms of the positive things that are happening to them in their daily lives and the negative stresses that they might be experiencing. It's asking them about the type of treatments that they've been taking. Have they been using medications to help their mood, for example, or have they been using other forms of treatment like light therapy? And also importantly, how were they functioning? Were they still managing to go to school? Were they still functioning in their job? Were they still being an effective parent as they would like to be, for example? So life charting is really an initial way of you looking at your overall history and getting a broad stroke, big picture view of what your experiences have been. Next, we move to a more fine-grained approach of measuring our mood, and this is particularly relevant for seasonal depression. I think one of the very effective things that you can do at this point is to look at your seasonal history. So, to some extent, your own personal responses to the changing seasons are predictable and somewhat idiosyncratic. One of the most important and powerful things I think people with mood disorders can do is look specifically at your early warning signs that an episode is on the horizon. Now, when we look at seasonal affective disorder in particular, what we see overall is that typically the first symptoms to suggest that an episode of winter depression is coming aren't symptoms like depression or irritability. They don't tend to be the mood symptoms. What they tend to be instead is subtle changes perhaps in sleep or energy levels. And then often after that, many people will experience shifts or changes in their appetite or their weight. And then after that, typically, they'll experience changes in their mood. So it's very important, I think, to have a look if you can, either by looking back over time, or if you can't remember very well what was happening to you last winter, partly because you were depressed and perhaps your concentration levels or your memory is affected by that, if it's difficult for you to remember about what kind of symptoms you were experiencing in what order last year, keep a seasonal chart in the coming winter to log very carefully what symptoms are key to you as an individual to suggest that an episode of depression is on its way. And there's another technique you can use to make this task easier. This is called a card sorting exercise. And if it's difficult for you to figure out what are your early warning signs, for example, one technique you can use is just to sit down and brainstorm what are your particular symptoms of depression when you're having an episode of winter depression, for example. You brainstorm and write down all the symptoms that you can think of that characterize you, and then you get 3 separate pieces of paper and you sort that pile of symptoms into 3 piles. Your early signs of depression, your middle signs of depression, and your late signs. And these might be things like lowering mood, and really what you're looking at is identifying those early warning signs so that you can implement some treatment changes or some self-management strategies before the episode of depression progresses any further.